What's up, guys? David DeCelle here, your host of the Business with the Boys podcast. And I'm very pleased to bring Garrett Vetter to you. Garrett was actually, once again, an introduction from our good friend, Aaron Newell. Aaron, thanks for being the gift that keeps on giving. But particularly, he went from being an employee to an employer, which is just always unique. And for those of you who feel stuck in a job, you want to do something on your own, this is definitely an episode worth listening to. Garrett Vetter, he is a healthcare operational leader and entrepreneur with over a decade of experience transforming hospitals, clinics, and outpatient surgery centers. He's passionate about improving patient care and quality of life for independent physicians through innovation, efficiency, and strategic growth. Garrett currently serves as a partner at a specialty services MSO supporting independent medical practices across the state and has a proven track record of optimizing operations, KPIs, and team performance. So, without further ado, let's go and learn from Garrett Vetter. Who knew I would make it this far? They hated, they never believed me. Yeah, I would never drop the ball. I know I make it look easy. Yeah, Mayweather with the defense. I don't care what a critic got to say. I got them picking up the pieces. That mean you really playing with your life. I'm about to come and run it all back. Well, Garrett, welcome to the show. I know, Landon, you had introduced us originally over email. Have you guys known each other for a while? Did you just recently cross paths, Landon? Help me understand kind of how this all came about.
Yeah, Garrett, what was that? Probably 3, 4 months ago.
Yeah, sounds about right.
I think we got connected via our good friend Aaron Newell, right?
Yes, sir.
Aaron, the gift that keeps on giving.
Yeah, yeah.
Well, he also cashed in on all the help he's provided us because his I think it's his daughter was selling football squares or whatever, and it's like, all right, we're obviously gonna say yes to this. Take my money.
I haven't won anything yet. Damn good cause though. Those girls go through some bats and some equipment. I know that, and their travel expenses are steep.
Yeah, well, thank you, Aaron, if you're tuning in to this episode, and Garrett,
Yes.
officially, welcome to the show. We appreciate you joining.
Hey, thanks for having me, guys. Really appreciate it. And I'll echo that thank you to Aaron. Aaron has connected me with more folks in a short time that we've known each other, and he is the gift that keeps on giving. So I appreciate it.
Yeah, it's an interesting. I'd like to think that Landon and I are wired in a similar way, but there's so much psychological income that's received when you connect people that get along, do business together, do cool stuff. And sometimes directly, oftentimes indirectly, you get rewarded in some way, shape, or form for, connecting, good people. And I'm sure we could share countless examples in all of our businesses where, that's been beneficial. But Garrett, give us a sense of your backstory, your background. I may be mistaken, but I believe you've gone from the employee world to now more entrepreneurial, if I remember our intro call correctly. But walk us through a bit of your story.
Yeah, happy to do it. I grew up in Western Nebraska. I was a farm and ranch kid, and
Yeah, yeah.
no better way to grow up, man. I mean, I think the work ethic comes out of that, and just the life lessons you learn at a young age. I mean, it was incredible. And I think my dad told me the most important things that he could ever, teach me, no matter what career you're in, is eye contact and a firm handshake gets you further in life than most, right? And so just that ability to grow up in that environment was, I took it for granted probably at the time, but now that I'm older and having kids of my own, I treasure that very much. So it was a good experience. We did cows, corn. I raised American bison for the first 15 years of my life. So, that's kind of a fun fact I like to throw out there because not a lot of people can say that, but it was super cool, man, super Western.
And those
When I
things can be
started,
mean.
yeah, yeah, you don't, you're not a lot of petting or like really getting close with them. So you kind of keep at arm's length, but it's super cool. Did the farm and ranch thing most of my childhood. Went off to college to Kearney, so I grew up in Chapel, Nebraska, about 2 hours on the I-80 corridor west. Didn't
That's
go too far for
David,
college.
for you, that's what I would call real Western Nebraska. I'm I'm not that far west. Chapel's
Well,
way out there.
and Landon, you still strike me as being out west. I remember driving to your house and it was the streets were like A and B and C. And
You
I'm
think
like,
I'm
what
west
the
being
fuck?
you think I'm west being in west of Omaha in Ashland? Like we're talking, you gotta go. What's Chapel from Omaha? Probably 5.
Yeah, probably five and change. Yeah, it's
Yeah,
Wow.
closer to Wyoming and Colorado than it is to Kearney. I mean, it's
for
like a
Your
10
sure.
minute drive
your
to the Colorado
reaction with
border.
me telling that story, Garrett, is I think of, have you ever seen the movie We're the Millers?
I have, yeah.
So you know the scene where they're all going through how much they're getting paid, and then the kid goes, "Wait, you're getting paid?" I picture you
No,
being
exactly.
like, "Wait, you have street names?"
Yeah, yeah. It was, stoplights were not a thing I was super familiar with until we went to college.
I'll echo that. We had one blinking light.
That's
Yeah.
funny. So, sorry to interrupt, but you were saying getting into your college career.
Yeah, no, it's all good. Yeah, went to the big city, right? To Kearney, Nebraska, population 35,000. Definitely not a large metropolitan area, but it felt like the big city. So came here planning to be a doctor. Was pre-med through college, had a full ride at UNK. That was the plan. I started doing some just odd jobs for nonprofits during college. Like my first job that wasn't farmhand was I worked for the community foundation here in Kearney doing some grant writing and helping nonprofits. I got plugged into a startup, for lack of a better term, that was a safety net clinic to help folks that were at a certain income level and were without health insurance in the surrounding areas around Kearney, like a 2 county radius. So I wrote some grants for him. I kind of helped him get started, and they actually hired me. They were looking for like an administrator, for lack of a better term. It was kind of like the first practice manager role. And I was going to night school, becoming an EMT, trying to just pad that med school resume, and thought, hey, this is far more. At least it's healthcare. It's adjacent to what I want to do. I'll go do that. So got a full-time job running this brand new safety net clinic, and I absolutely loved it. I'm fast forward to today, I'm actually on the board of directors, which is surreal to go
That's
from,
cool.
being an employee there to now being a board member. It was, healthcare unadulterated, man. I mean, it was super cool. You came in these people, it was all just kind of the honor system. Like if people walked in and said, hey, I don't have health insurance, I'm using the ER as my primary care provider. Where do I go? We saw them, we took them. Volunteer providers, volunteer staff. There was like 3 people on the payroll. That was me and a couple other coordinators. It was just super cool. Loved it. It was kind of the Wild West where we didn't deal with insurance and prior authorizations and things that really gum up the works of healthcare. So that was my first, stint in healthcare admin, and it really just changed my career path. Decided I maybe didn't want to go to med school. I kind of liked that side of things. I liked coordinating resources, and I've said for the last 10 years of my career that I work with people that take care of people, and my job's to take care of them. And I really just loved doing that at that little free clinic. You still really got a handle on how we could get creative in that space, find a way to get access to care or medications or resources. Loved it. Finished my undergrad while I was working there full time. And then it probably wasn't a place I was going to retire. It was a small nonprofit clinic. Got headhunted by a rural hospital down the road. Took that job and just thought I was killing it. Right, went from working for this tiny safety net clinic to having a leadership role at a critical access hospital. And they really took a chance on me, man. I alluded to the fact that I knew nothing about insurance, payer contracting, or just the bones of healthcare, and the regulatory burden was all new to me. And so I went to work for Gothenburg Health I was there for about 4 years. But when I started, I oversaw a couple of clinic departments. So I had a rural health clinic and then a hospital outpatient clinic. And then there was a couple of moments during my time there where like a department head would leave, and we'd sit to these meetings, and or my boss or the CEO would ask, hey, this department needs a leader. Like, who has the capacity? And I raised my hand every time. Like I was like, I want to learn. I want to do it. Like, surgery, no problem. I'll figure it out. Payer credentialing, I'll figure that out. Like, just kind of took on other responsibilities. Felt like I had a good relationship with my peers, so people were easy. I felt like I knew how to talk to, if it was a physician or a patient or a vendor. It just felt like I could figure it out and was just honest. And so I grew my departments from like 2 to like 6 by the time I left, and just learned a lot. Great people, great facility, great community. And so I was sitting there right after the COVID-19 pandemic. It was like 2021. And this physician that I knew from Kearney that I actually met through my free clinic days. He stopped by my office. He did outreach there, so he came, once a month to do surgeries in that facility. Stopped by my office one day and said, "Hey, you ever want to move back to Kearney?" And I was like, "Yeah, maybe. I mean, I kind of like what I'm doing here." He's like, "You should call me." So that weekend, I think we talked on the phone, and he had a surgery center that he owned here in Kearney with another physician partner, and their administrator left and they were looking for somebody else. And I was like, we really liked Kearney. My wife and I always called Kearney home. And so when on the weekends, we would drive back to Kearney. And so I was like, oh, we'll see if this is something I want to do. Private practice was also new to me. And it's a completely different side of the ball in healthcare. So we came, met, loved it, loved the staff, loved the physician owners. They're just great entrepreneurial guys with half a dozen LLCs to their name that, we're just really getting started doing some pretty cool things. And so we did it. We made the jump, came to Kearney, stepped into an outpatient surgery center. Um, and when I came into that role, I don't think I realized how compartmentalized it was. Like I said, these guys had a bunch of companies. They had real estate, clinics, a surgery center. And it kind of evolved in my first couple of years where I was the de facto administrator of multiple entities without like a line on the org chart to really make it work. And so we talked, after a couple of years about how, hey, is there a way that we can consolidate things? How can we, maybe not have our overhead chopped up 6 different ways? How can we, get one payroll? So we came up with this concept of yet another LLC, some sort of administrative body to do it. And while we were on the finish line, one of the partners, he's just kind of an end of career guy, like still practicing, just maybe didn't want to go through all the contractual gymnastics of setting that up. And I didn't blame him at all. So we just kind of had this called an audible in the middle of it. And the remaining partner just came to me and said, "Hey, would you like to do this together? How about we just come in? We'll be equity partners. Let's form this administrative consulting body, and we'll improve our own, get our own house in order." So sounds good to me, man. So we formed Vital Virtue in 2024, really just to manage our captive group of businesses, just a way to streamline things. In the first year of operation, I mean, without really any marketing, just essentially having a dinner or a beer with a physician in town or somebody we know, just saying, "Hey, we're doing this thing. We think it's helping out with our costs." We've consolidated things in such a way that we can build efficiencies, get some critical mass to go get bulk deals on things. And everybody kind of wanted in on the ground floor. So we grew it by 300% in the first year, really just organically talking about it. And so we went from let's figure out a way to run our own businesses more effectively to really inheriting a specialty MSO that was managing a ton of groups. So we currently have contracts from Lincoln to Kearney with surgery centers, small outpatient clinics, critical access hospitals, just the whole gamut. And it's been super exciting.
There's one of the main things I extract from that story is to get to where you are now. Um, if I heard you correctly, there were more instances than probably you could count where you just raised your hand and took on more stuff. And by doing so, I would imagine you were able to get sort of a 360 view of the whole operation that then ultimately gets you into a position where you are today to where you can understand and empathize and appreciate the challenges that other people are going through. You just now happen to have the solution, but it all came from raising your hand. Yep, I'll do that. Yep, I'll do that. Yep, I'll do that. Even before you were ready to, because like you said, you'll figure it out. I am curious going back. I think there's probably some lessons or tips, if you will, in this part of your story, going from working at, I think you said nonprofit, to being on the board. And you mentioned how it's just kind of surreal going from point A to point B. What would you say that organization saw in you that got them to ask you to be on the board, or did you just ask to be on the board? Like that, there's a lot of people that start off at the ground level somewhere and want to work their way up, and you've done that. I'm curious to know some of the qualities and things that you did along the way to get yourself in that conversation and ultimately in that position.
Yeah, it's a great question. Tough to answer while trying to remain humble, man, because I do not think that I am better than the next guy. I think I've just been in enough arenas and rooms to have a pretty broad view of the world. I think I've worked enough settings that to your point, I do feel like I have a pretty 360 view of healthcare, but certainly not everything. It's impossible to know everything in healthcare. It's so complex. I think what was exciting for them about my desire to come back and help in some way. They had a 10-year anniversary dinner in Kearney this last summer, and I just stopped by to bring a donation, say hi. It's been 10 years, 3 years since I walked in the door. I just want to say hello, and that's when the executive director caught me and said, "Hey, do you want to serve on the board if you're back in town?"
Mm.
And so just that I think if I could guess, I have history with it. There's not a lot of people that can be a servant leader in the capacity as somebody that's worked there, right? Like I understood the mission, I understood what boots on the ground it was like. And I think, sitting in the board of directors chair, it's certainly valuable to have experience in, accounting and legal and healthcare. All those are great, but I have enough healthcare experience. Plus, I worked there. I know how it operates. I know the population it serves. I would assume that it was helpful to have somebody in that chair that understood those facets of it.
Um, I was talking with a friend of mine, Chris, recently. He's become a friend through his wife, who's my wife's best friend, and he's looking to, change careers. And one of the things that he said that I hopped on him for right away, he's like, why would anyone want me? I don't have any experience. I've always only done this. And I was like, I gotta stop you right there. A, careful of your self-talk. B, you also have to realize that once you get in the rooms of the people that are intimidating you right now, you'll realize that no one really knows what they're doing. Everyone's kind of figuring it out. What was your experience with that as you were working through the various roles that you were raising your hand up for? Like, were you trained or were people like, hey, we don't know how to do this? Like, can you figure it out? Like, what was that dynamic like?
Yeah, I have a graduate degree in public health, and I think there's a little bit of healthcare finance involved in that, and so certainly I came into those roles knowing how to read a P&L and a balance sheet and how healthcare facilities operate. Sure, um, iron sharpens iron, right? I mean, if you surround yourself with people that are, better than you and that you are willing to talk to you and mentor you in those areas, I think it goes a long way. And you're not going to find somebody to elevate you by being scared to walk into those rooms. And so I think the first step is just committing to, hey, I'm gonna try this, or I'm gonna talk to this person, ask for advice in these areas. um, I was very fortunate in my career to just be, right place, right time. And I don't think any job that I've ever had that I enjoyed the most was one that I ever sought out. And that's a blessing that I don't think a lot of people, well, maybe some people can say, but I was, it just felt, like God was kind of, pushing me in directions that I wasn't even aware of at the time. I was never going to go work at Gothenburg Health. Like that wasn't on my vision board, like I'm not sitting there saying I want to do that. It was a phone call that I answered. And when I came back to Kearney to start this journey, it was a phone call that I answered. And I think the reason why those phone calls hit up my phone is because you surround yourself with people in a network of people that either see something the way you carry yourself or the way that you view the world or how you interact with others. And when they have a need or a void that they want to fill, people are more interested, at least I am in my career, in working with good people than working with somebody that thinks they know everything about an individual subject.
So I'm going to
You
assume there's been no regrets on not going the physician route.
Oh, that's
Are
a
you
great
close
question.
enough that it scratches that itch, or have you ever been like, damn, I wonder?
It took me a few years. There was definitely, not to get too deep on you, but there's definitely a period of time, after I switched paths and kind of went through different grad school and didn't really, I had a moment like a couple years after finishing my master's where my wife and I were cleaning out our attic, and I had all of like my med school prep, like my MCAT test books, like just sitting in a
Like
box.
no better stereotypical way than cleaning out your attic, by the
Right? Yeah. Yeah. It was like a
way.
Hallmark movie. It feels cliche talking about it. But
Yeah.
there was just almost this moment of closure where I think we like sold them on like Facebook Marketplace or something, or like gave them away. And I was just like, that was kind of the end of it. And it was a nice closure moment where I didn't feel like I missed the boat on it. I really love what I do. And especially now, if I had known what I know now then, wouldn't have shed a tear, wouldn't have thought it, because I feel like we're doing so many cool things in this space. And being, caring for people. If you talk to physicians, of course, they all got into it for the same reason, this desire to take care of people and do good. And it's so hard to do that as a physician today with the landscape. And it just feels like it gets buried under everything else. And I feel like now we're uniquely positioned where I can bring that back for somebody, hopefully, if we can come in and reorganize reshuffle the deck a little bit and put people and patients and physicians in places where they can actually just take care of people and we can take care of the noise.
So can you unpack in a little bit more detail what you actually do now in layman's terms, like the folks that you're working with, what are some of the challenges that they're experiencing? Forgive my ignorance, but I think you used an acronym earlier, MSO, which I don't know what that is. So if you can just sort of go a little bit deeper, I want to make sure that Landon and I, for purposes of making connections, but also the folks tuning in, know exactly what you guys do.
Yeah. So an MSO is a managed service organization, and definitely not a new concept to healthcare, but I think the way that we're doing it is novel. Most of the time they come in with some sort of equity arrangement where they maybe have combined ownership or majority ownership in certain areas where they can actually get that kind of that bulk buying power, that scale through ownership. We have no equity in any of our partners. We come in just on straight service agreements. And it's kind of a big cooperative in some generic terms. So I'll start kind of broad and then bring it back, sharpen the pencil a little bit. Um, there's a book that was written by the current CEO of the Medical Group Management Association. Dr. Haley Fisher Wright wrote this book called Back to Balance, and she talks about how healthcare was once upon a time a balance of business, science, and art. And a lot of the issues in today's healthcare landscape are that equation's no longer balanced. And the art of medicine has really taken a back seat to the business, and maybe even behind the science of medicine. And so our mission really is to support independent medicine or other service organizations that doesn't need to be independent, but our heart lies in independent medicine, in helping them bring the art of medicine back into their practices. Like, if you're a physician, you want to care for people, you're an artist, you're so focused on the business that it's impossible to focus on the art. And so we want to come in and say, hey, we'll take the business, you do the artistry, you can look at the science, and focus on what you went to school for and what your skill set is. I read an article this morning in Becker's that I thought is kind of funny, very, very appropriate for this conversation. There was a survey of about 1,500 physicians across the nation, of which half were self-employed independent physicians. And they asked them what they hated the most about their job. And over a quarter of them, I think 26% said they hate running a business, 23% said they hate managing personnel, and over 20% said they hate dealing with regulatory compliance. That's what we do. Everything that you hate about that independent physician role, we can take care of for you. So if you can name a business function in healthcare, we do it. We do accounts payable processing. We do billing and coding, any sort of revenue cycle solution, getting stuff from patient in office, generating a claim, processing it, getting it out the door, taking care of the payments. We have a whole department for that. We sell managed IT via partnership, staffing, benefits management, anything and everything in that business operational space we provide. And it's not a one size fits all. Most of our clients don't want every service that we provide, and that's okay. I think where we
So
pride
they can
ourselves,
do it a la carte.
yes, sir. And I think that's our big selling point is we can come in and say, what are your pain points? Here's our menu.
Yeah, I will
Check the
tell you
ones you want.
that's unique in your world because most MSOs are going to say, "Here's our rules, play by them."
Correct. Yep. And that's been our experience. And I don't think that works for everybody because if you've been in one clinic or one surgery center, you've been in one clinic or one surgery center. If we can come in and meet them where they're at, I think the satisfaction for them is better, and we're able to support our mission and serve them better. A lot of what we're trying to do, we're about 18 months into it, and so what we have today isn't what we're going to have tomorrow. We have some technology things we're working on. We have some things in materials management we're working on. One of our voids right now is supply chain. And, there's a reason why, like United Healthcare is the largest employer of physicians, owner of specialty practices and surgery centers in the country, because things get cheaper when you're super big, right? And so as we grow and as we start to sharpen the pencil on some of this stuff, we have some really exciting things coming down the pike with supply chain, some bulk discounts on materials management stuff, as well as just software solutions to help these practices run.
Now, do you first shared the example that, these folks that you originally partnered up with as you formed this company, they had like six different businesses. Do people that you work with need to have that layer of complexity, or can they just have a private practice in a singular fashion? Like, what does that look like?
There's no practice too small. I mean, and the organizational or the corporate complexity is completely irrelevant to us. We have a couple of clients that are just like single doc practices whose, like wife is their office manager. And sometimes the conversation is, how is that working, for your marriage or your practice, if we can come in and help out, and we don't want to take anybody's job, we just want to work adjunct and support, any of those service lines that I mentioned with the existing team, or if there's a void that we can fill, we're happy to do it. But no practice is too small. We want to support independent medicine however we can.
I'm already thinking Landon. So I had uh, my physical this morning, by the way, which I talked myself out of a routine prostate exam. So I'm feeling good this morning compared to what I was expecting.
Kennedy give you that or no?
Uh, It's weird. Last time, his both his hands were on my shoulders. I didn't know what was going on.
Yeah.
Uh, no, but so I had my physical this morning, and he's a concierge physician, private practice. Literally, it's successful business, but it's him and his wife is the nurse. And his wife also does all the administrative stuff. I think about Landon, the podcast that we have later on today with Dr. Todd Johnson, who's a concierge physician. And then I'm thinking about Himmelberg. So we may have a handful of introductions just right off the bat that I think.
I'm sure Garrett knows Hemi.
Do you know Jeff Himmelberg?
I don't think I do.
You
No,
definitely should.
interventional radiologist. They go all the way from North Platte to Omaha. Him and his partner started their group, and his partner's, I'm blanking on his name, but out in Grand Island, so he'd be close to you.
But is
Is that
that
Murdoch?
What's that?
Is Murdoch his partner?
I don't know. I'm blanking on
Uh,
his name.
oh, that's all
but
good.
it's
Yeah, I'd
it's
love to connect.
that
They
but it's
contract with
also
hospitals all over.
but he also has like a vein center. He has a wound care business. So like he's got multiple things going on. Um,
David
so
Somm for the penile pump portion of the
I did
business.
not. He has a upsize Omaha is what it's called, and I have not seen him yet, Landon.
Yeah, yeah, yeah. I'll let you know how mine goes first.
Oh man.
But I mean, again,
Uh,
he's just an entrepreneurial minded physician,
and he doesn't
which
want to
I
do
think
any
we
of
need
this
more
stuff that
of.
you
Yeah.
do. You know what I mean?
If
Like
you could keep him
he'd
cranking
rather
on
just be,
procedures, yeah.
yeah.
Yeah, that's
Um,
great. Love to meet those kind of guys. There, I think that entrepreneurial physician is kind of a rare breed. Most of the time there's not a class in med school to teach you how to run a business, right? And so I think these guys, they're certainly all very intelligent people. And so I think a lot of them come into it, thinking that, yeah, I'll figure this out. And I'm sure they can. It's not that they're incapable. It's just, it's not what you enjoy, right? And so if we can, bring a little bit of quality life to you, that's the vision. So yeah, I'd love to connect with anybody you think there'd be some synergy with.
Sweet. Earlier you mentioned, um, I think you used the word vision board. I'm curious, what's on the vision board, so to speak? Like, where are you taking this company from here? You mentioned simply through conversations and dinners and whatnot, you guys experienced a lot of organic growth in that first year. Um, what's next?
I want to conquer the world, brother. I think, I think that there's just so much that we can do in this space. And I think more and more every single year as, cuts unroll from CMS, like there's going to be a breaking point somewhere, and innovation is going to have to come out of this. Like it's the only way that we figure out a better way to take care of patients and remain solvent as a healthcare system in this country. And so I'm hoping that we can have a really ripe opportunity in the next couple of years to do that. I talk to physicians all the time that want to form this, rebel alliance against the man, right? Like you want to, do we go on strike? What do we do? How do we get reimbursement where it needs to be? How do we reduce costs? And some of that stuff is just hyperbole and it's not going to work. But there's some truth to banding together for a cause. And if we
There's a
can
lot of
come in,
truth in it. I
yeah,
think they need to do it. I mean, everybody wants to say, oh, physician, this, they're making so it's like one, they have to make good money. And two, I want to pay them good money because I want to know they're educated because they got through school and they're the best at what they do. But what people don't realize is the insurance carriers. I mean, I know this obviously from working with physicians, day in and day out, like the reimbursement rates and everything else. It's like if they just paid them what they said they were going to pay them, it's like, okay, well, we're going to pay me 35% per procedure. Well, then the procedure cost is just going to go up. You know what I mean? It's like, let's just find a way to make this thing fair.
yeah, agreed. And I think the general public has somewhat of a misconception on, charges from healthcare services, right? Like you get your bill, you go to the hospital, you look at your EOB, or you go to your primary care provider and see what they charge, and they're thinking, oh my God, these guys are making a killing. They're charging $1,000 for the service. Well, a lot of people in private practice or institutionalized medicine, they charge 2 or 3x what they're going to get paid, because if you don't, you're just leaving money on the table somewhere. I mean, Medicare doesn't keep the lights on. And some of these governmental payers, you do it because you have to and you want to, you want to care for people, but you got to make a margin somewhere to pay people. And the world's more expensive today than it was 10 years ago. And I mean, I could talk for an hour, and it wouldn't take much of a Google search to go find a graph that compares like the CMS fee schedule against inflation, and just how significant the gap is there. Charges don't mean anything in healthcare. I mean, it's just ones and zeros to try to find a way to squeeze a little bit more money out of these commercial payers that are lining their pockets. And the Affordable Care Act really, changed up the game with how those premium payments work and what those governmental pay or those commercial payers can do. And it's tough. And to some degree, forming that rebel alliance, finding a way to band together, reduce costs, advocate for independent medicine is where it's going to have to end up.
So with everything that you've shared, in theory, it sounds good as it relates to, okay, now the physician, the business owner no longer has to do certain functions, and I'm sure it changes based on, how many of the menu items they're choosing. But I'm curious, when someone works with you, what's the range of time they actually save not having to deal with the stuff that you guys are taking off their plate? Because if I'm a physician, and I'm making this up for sakes of the example, but if I'm with a patient, I'm going to make $2,000. But if that hour that I would be with the patient, I have to do administration type activities, that's something where now I'm not making that $2,000. So I'm thinking, okay, if I'm saving X amount of time and I fill that with patients, my income's going to go up by Y, and I'm going to be able to help all these other people. So with that in mind, what feedback do you get from the folks that you work with in terms of time saved?
Yeah, I don't know if I have any quantifiable like hours in the day, but I think a really close analogy is, like profit margin. If we could replace, or at least serve as several FTEs without being FTEs. I mean, you might need a prior authorization person for, I don't know, 3/4 of an FTE, but you got to pay an FTE, right? You got to go pay somebody 40 hours a week. Like you're having these expenses that maybe you don't need. I think a lot of the value is you can use our services as much as you need them and no more. Like you don't have that extra, quarter of an FTE expense that maybe you don't necessarily need, but you have to support anyways. I think it's been a couple of years since I looked at it, but the last MGMA is the Medical Group Management Association. They're kind of the premier source of data on independent practices or medical practices across the country. They have a ton of data, and if you look at they pull some statistics that talk about like profit margin in outpatient clinics, and I believe in maybe 2023, 24, it was about 36% was 36 cents on the dollar is what a medical practice keeps because the operating margin is so high. We come in and I think we could get that somewhere between 46 and 56. I mean, we can create 10 to 20% in operational margin space just by the scale that we have for some of these services.
And that's impactful,
For
very
sure.
impactful,
Especially with
especially.
those margins being so thin. I mean, that 36 cents on the dollar, I mean, if you look proportionally, a lot of these are, $1 million, companies. I mean, that's a lot of money.
Yeah, better than the restaurant, but still.
Yeah, very true.
Um, what is there anything that we haven't asked you yet that you think comes to mind that would be helpful regarding your journey, or do you feel like you've captured it all?
I think we've captured a lot of the history. Two things I'll plug real quick if you don't mind on kind of the
Please.
future, just to tailor off your last question. Started connected with the medical school here in town as well. I think if there's an option that we could get in front of medical students, not everybody's going to leave, a medical school and just be like independent medicine all the way. Like, they got bills to pay, they got student debt. I just don't think that enters their headspace, right? You walk out of there with $250,000 in debt. You want to go take a W-2 at a hospital, make some money, and pay off your debt, not worry about it. I think it's important that we start with this new generation of upcoming physicians and talk about how independent medicine, how important independent medicine is. It's a pendulum. If you look back 20 years ago, I think the majority of physicians were independent, and then there was this big push in the early 2000s, 2010s for everybody to go be employed by hospitals, and that's now 60% are employed, 40% are independent. That's going to come back at some point, I think. I think it has to. And so for us to get in front of these new graduating physicians, and even have a student interest group or a seminar and just talk about like, hey, if you really want to go be your own boss and you want to really control the care that you're rendering as a physician owner, we're here to support you. Here's some things to look out for. Here's some common pitfalls. Be a resource for those folks. And I think it pays dividend in the long run. Maybe they go out and they work for a hospital for 5 years and they hate working for the man. They call me in 5 years, want to open a practice, and we can give them a playbook. So really excited about that opportunity. Really grateful for the University of Nebraska Medical Center for at least talking to us about it. And then technology is a space that I'm super interested in. We have a separate passion project to develop some automation tools and some AI stuff. I'm not a tech guy, and so I need to be careful with how detailed I get about it, because somebody's going to call me out on stuff that's not possible or not feasible. But I think there's definitely some exciting opportunities for us to make some solutions in place for our current group of practices and clients, as well as some we haven't met yet, to streamline things even further. And maybe that 10-20% operational margin we can provide is double in a couple of years. The nice thing about what we're doing, and what I'm really excited about, is in the space of AI, which is pervasive already and will continue to be so. I think if you're in healthcare, if you're a small practice with a small staff, and maybe your wife is your nursing office manager, I doubt you have the time to really explore how to bring that into your practice and troubleshoot it, and invent, get a UI, patent a UI, go pull together some open source stuff. It's just not on your radar right now. And you're really missing the boat, I think, on where the future is going to be. And so how you get it is you get it through another solution, another vendor that you work with, right? Like your EHR company is going to have some sort of baked in AI solution. And that's great. And they're probably, these guys, these large EHR companies have super smart people, teams of developers. I'm sure it's a great tool. But if you decide in a couple of years that that charting system is taking advantage of you, or you don't like it anymore, it's already super painful to switch. I mean, there's very few more impactful things you can do in a practice besides switching the charting system, which is the lifeblood of that organization. Not to mention, if you become dependent upon any sort of automation workflow or solution that's baked into it that makes your life better, it's just even harder. So our goal is to develop these automation tools and these solutions that we don't handcuff anybody to. If you want to come on board as a member of the MSO, we give you the tools. You like them, you don't like me in 5 years, keep the tools. I don't care. If it supports your practice and if it makes your life better, it makes the life of your patients better, we're not going to handcuff anybody to anything. And so I think that's novel to us as well. Just this pervasive desire to support independent medicine and not keep anybody locked into a long-term agreement.
Love it. Well, Garrett, one of the questions that we ask all of our guests is a book that's had an impact on them. And you made mention of a book called The Culture of High Performance. What made you pick that, and what's the impact that's had on you?
Yeah, so it's written by a guy named Quint Studer, who's big name in hospital culture consulting. I think anybody that works